bad, I'm late. Shit. I don't know how that happened. It was just, the traffic in Cambridge, it's amazing. You always get stuck in the traffic in Cambridge. It's so pathetic. They're tearing up the whole street. Plus, I was like finishing up some my notes for my patients, and stopped at Starbucks. And I'm going to get my breast MRI, and it sucks. But, it feels like this could be the turning point when I go from being a doctor to a patient, and I have to think about mortality and that my life has bookends and take toxic chemicals. But I'm healthy. I eat kale, cauliflower, anything random that's healthy, and I breastfed my 3 children, and I'm a marathon runner. I'm probably good to go. Okay, I gotta fill out these forms. Yes, I'm postmenopausal. No invasive breast cancer. No carcinoma in situ, never been tested for BRCA gene, not exposed to DES. No breast reduction, no surgical biopsy, no core needle biopsy, no radiation treatment, no breast reconstruction. Oh, red flag. My sister and my aunt had breast cancer. No permanent eye tattoo liner, no dentures, no IUD, no cardiac pacemaker, no shrapnel or bullets. Great, I've got teeth and my heart works and I haven't been shot. I guess I'm good to go. Hi, I'm Jenny. I'll be your nurse today. Everything off except for your underwear, opening in the front, metal objects off except for your rings. Some people like to listen to music. She hands me a list. U2, no. Beatles, too retro. Carole King, So Far Away. That is so cheesy. What about Adele? She's upbeat. She's got big boobs. I'm going with her. Some people get nervous before their test. They get claustrophobic. Do you get claustrophobic? If you get claustrophobic, just squeeze this blue ball. We'll stop the test, and you can come back another week. Let's just get the test done. So she flips me over onto the gurney, face down. She rolls me into this tight tunnel. My hands are hanging out. My feet are hanging out. I've got headphones on. Blast off to nowhere. I mean, what happens if she faints or she, has a heart attack? I could be stuck in there forever. Finally, after 45 minutes of Adele, I'm done. I walk into the doctor's office, and he's looking at these images of my breast, and he says, "It looks clear here. It's looking clear on the upper margins up there, and then there's something the size of a small eyelash. It's like an elongated cigar. We'll need to take a closer look at this."
Hi, Nancy. It's Dr. Specht. How are you? I assume you're probably swimming Walden Pond in the freezing cold, but I do finally have the pathology results. It was a little bit complicated. Sorry it took longer than normal. Call my office. I'm seeing patients, so I'll try to grab you in between in order to relay the results. Take care. Bye.
Your name, your date of birth, name. Date of birth. Your name, your date of birth.
This can't be happening. Micronesia, they say.
Do you know this?
Micronesia. I say macro trouble, macroaggression. They told me I need to have clean margins.
So healthy.
I eat broccoli, cauliflower.
What's going to happen to you? What could happen to anyone?
If you were planning a 2-month vacation radiation with thousands of patients, I would recommend you go. I'd be scared too. Biopsy is like looking through a keyhole.
My bones could ache and I could get muscle pain and it might stop me from running. Talk to the surgeon about being lopsided. They told me I need more time. I would actually die sooner than I would like. Don't walk with fear. Don't walk behind. Don't walk with fear in front of you. Walk with fear beside
Find
you.
a comfortable position and
What
close
many
your
doctors
eyes.
consider to be a very early form of breast cancer may not
Take a deep
be as
breath,
risky as once thought.
and while
I was so
exhale,
relieved by
feel
your
a
study
deep
out
let
today.
it go.
If yours Rob
Given
Stein reports
radiation
that the
to thousands
findings
of
of the
patients,
latest indications
To help you enter a deeper, healthier
This would tell me I need my kids right now.
don't be scared to.
Hi, this is Dr. Rappaport. We're going to need to reschedule our appointment. Yes, I'm having an operation on Monday, and I'm going to be taking a month off. No, well, I don't exactly know I'll be fine. It's just I'll know more results later. Yes, I appreciate your concern. I have a wonderful doctor covering for me, Dr. Kulik. She's terrific. She'll take good care of you. Thank you. Bye now. After my diagnosis of breast cancer, I started coming to Mount Auburn Cemetery. When you come through the gate of Mount Auburn Cemetery, it's a straight shoot down Central Ave, and you come to the dell. And the dell is a sacred place. It's a natural amphitheater. And in the consecration of the dell, it had 2,000 people there. And now, it's an audience of one. At dusk, if you listen, you can hear the owls crooning. And I'm coming to make sense of a trade I'm to make. I will offer my breast for my life. I need to figure out what this means. The twilight crosses the sky in bursts of pink. And the security guard urges me, time to leave. The living are no longer welcome here. And when I'm walking out, I see angels in flight, captured in stone. I could use an angel right now. Once, I saw dancers dressed in white here, twirling in flight and motion as if angels. Will this offering sever me from your touch? And there's the nurse. She's in charge now. She's the boss. Can I wear these socks? Amory gave them to me. Amory is my best friend, close friend, next door neighbor. And she was diagnosed a year apart on the same day as me. She's taking such good care of me. She makes homemade warm bread. I mean, who makes homemade warm bread in Cambridge anymore? And she makes me kale salad with mango and toasted almonds. And you should meet her kids. They are precious. Thea, she is 7 going on 21, and she tells me about the American Cancer Society as if it's a debutante ball. And Torian, he's little, and he divides the world into those who believe in fairies and those who don't. I need these socks. You can't wear those socks. You could get an infection in your boobies. You don't want an infection in your boobies. Nothing from the outside. You needed your boobies to feed your babies. Now you have cancer. They need to be removed. I can't even wear my own socks. Then this beautiful Ethiopian woman wheels me to the operating room. And she must have asked me like 10 times, what's your name, date of birth? Name, date of birth? She could have asked me 20 times, just the way she was. She asked me, can I get you anything? Is get me out of here an option? And then I tell her, I'm cold. And she gets me not 1, but 2 blankets. And then she's gone. And I'm alone. Colin, my husband, has been by my side for every doctor's appointment, every doctor's test. He even came with me to see the nutritionist who grows goats in her backyard and told me to eat goat's whey and ostriches because they're pink and they're strong and something else random, I can't remember. And the surgeon told me that a biopsy is like looking through a keyhole. And when I wake up, they'll have figured out whether I have metastatic cancer, which means I have cancer in my lymph nodes. And if I have cancer in my lymph nodes, then I need to have chemotherapy. And I'm making bargains with myself. Take my breast, but I don't want chemo. Wait a sec. I am getting way ahead of myself. I've been practicing for 3 weeks every day, Healing Faster with Meditation, Peggy Huddleston's tapes. Have you heard of that? It's an amazing tape. Well, sort of. Close your eyes. Think of a beautiful place with golden light. Breathe in. What does Peggy Huddleston do if she gets stuck in traffic or has a fight with her husband? Okay. Breathe in. Breathe out. I hear 2 nurses. What's on your schedule today? Oh, I've got abdominal fat around the vocal cords. That's disgusting. You want to go to a barbecue? Sure, as long as my meat's well done. Breathe in. Clench your fists. Relax. Can you guys keep it down? Then the anesthesiologist comes in. He asks me, "What can I do for you?" "Take care of me." "What are you going to eat after you finish up?" "Kale salad, mangoes and toasted almonds and bone marrow soup." "I like my kale charred, 350, 10 minutes. Then he puts an IV in me. He puts a patch on me. "This'll be the last time that I hurt you."
Patient name, Rappaport Nancy. Date of birth, October 15th, 1959, age 55, sex female. Medical record number 2559262. Left breast mastectomy. Residual ductal carcinoma in situ. Atypical ductal hyperplasia. Lobular neoplasia. Atypical lobular hyperplasia. Fibrocystic changes. Received fresh, labeled Nancy Rappaport, number 2559262, and left mastectomy is a 20.0 by 14.5 by 2.2 centimeter simple mastectomy with a short suture designating superior and a long suture designating lateral. The nipple and areola appear unremarkable.
Who could design it better? Frogs in frozen ponds, alive. Bears denning, their hearts dropping beats, breathing shallow, waiting for spring. Who designed DCIS, this hijacked rogue plan, disseminated carcinoma in situ, like the branches of a wintering tree etched in my breast, disposed of now? I dreamed that I had two breasts and that I stepped into somebody else's life by mistake. Will I ever wake? The day before my mastectomy, I went to see the plastic surgeon. My radiologist told me, "You need to be fully informed. You're young. Most women who have cancer don't want to wake up every morning and look in the mirror and be reminded that they have cancer when they take off their bra or put on their clothes." There's a whole movement to get a new you. Out with the old, in with the new. 80% of women who have mastectomies have plastic surgery. The plastic surgeon has platinum blonde hair, high heels, and a crisp suit. She shows me her portfolio of breasts, her post-mastectomy gallery. You could look like Sophia Loren. You could have small breasts, medium-sized breasts, large breasts. It's the silver lining in your breast cancer. Now, you could have the autologous flap reconstruction or the silicone implants. If you go with the autologous flap reconstructions, you could have a tummy flap, a butt flap, or a hip flap. Now, you're probably a little bit too thin for that, so you could go with the latissimus dorsi, which is the big muscle in your back. It makes a nice mound in the front. Get a big scar in the back, but it looks great in the front. Or you could go with the upper gracilis muscle, which is in your inner thigh, and make a lovely breast in the front. Now, some women find that they lose sensation in their breast, but that's a small price to pay for a natural silhouette. You know, you could be sorry if you wake up tomorrow and you haven't done plastic reconstruction. I am a marathon runner. You are not taking my thigh muscle. It's not happening. I've been researching about breast cancer, mastectomies, plastic reconstruction, and I came across this really cool website. It's called Breast Free. I think I'm the kind of woman who doesn't do plastic reconstruction. Strong women who know that their breasts don't define their identity. Confident women who know whether they have a low cleavage or not. They look great. Mature women who know their friends, family, and spouse don't make judgment about whether they have breasts or not. An active woman who continue to exercise without restrictions. That's my kind of woman. Strong, confident, active, mature. Maybe I'll celebrate my breast-free state by getting a tattoo. Should I get pictures or words? I mean, I look online and there's about 18 sites for post-mastectomy tattoos. And I go on one of them and it's a porn site, which is really awkward. And then I look at Pinterest mastectomy tattoos, and there are so many kinds of tattoos you could get for post-mastectomy. You could get a skull, you could get a swordfish, you could get Medusa, you could get a rat holding a beaker, a hot dog. These are like, okay. Do you know, October 6th is my operation tomorrow. And you heard October is Breast Cancer Awareness Month. And maybe I could get a discount. I mean, nipple tattoos, $400 to $600. Wait a sec. I look at the surgeon. Thanks. I'm all set. I'm good. I need to redefine beauty. It is no longer skin deep. I crave freedom from vanity, from longing for what was. Can I make a new word? Be breasted? Meg and I are going to, Meg's a close friend of mine, and as part of my recovery, we're going on walks in Mount Auburn Cemetery. Mount Auburn Cemetery is gigantic. There's over 60,000 monuments, over 100,000 dead people. I mean, Meg told me that patrons sponsored sculptures and monuments like the huge Sphinx in the front entrance, which is about 40,000 tons, which was made to commemorate the Civil War, or their Celtic crosses, angels in flight in stone, mothers holding babies. There's even their favorite dogs. It's like an open-air art museum. And Meg is the first art curator at Mount Auburn Cemetery, and she's been working there over 20 years. She preserves the monuments. I go to visit her at work. She is tall, elegant. She wears pearls and sparkly necklaces. She looks like an angel dressed for work. I can barely walk. I don't have metastatic cancer, but I've never felt so tired. And I'm still tethered to a drain that's collecting blood from my wound. I'm tethered to this tube. Meg, she takes my hand underneath her arm and she asks me, "Where do you want to go? What do you want to see? How'd you sleep last night?" We're walking, and I would have walked by half of the monuments that she's showing me. I wouldn't have noticed them. Look, there's a chrysalis, a metamorphic moment of change, transformation, caterpillar to butterfly, upward movement. And look, over there, that's the parents lost their son in a motorcycle accident, and they thought it would be appropriate to have something silvery and metallic. Oh, and over there, that's Hygeia, the monument of goddess of health and hygiene. It was commissioned by Dr. Harriet Kezia Hunt, and she was a physician in the 1850s. Nancy, you would have loved to have met her. She was someone who devoted her life to caring for prostitutes and their children. When there was rampant infection, no antibiotics, and 40% of children died at childbirth. She practiced for 40 years, and she commemorated it by making this statue. Oh, that's her tombstone. It says simple words. She hath done what she could. Okay, I gotta go back to work, Nancy, but you can stay here. You might wanna go see Alice's fountain. The story goes that Alice's mother lost her young daughter, Alice Hemingway, and she designed a natural landscape to commemorate her loss of her daughter. I'm walking and looking and looking. I can't find Alice's fountain. I don't know where it is. I asked the maintenance men, and they're Puerto Rican, and ¿Dónde está el fuente? Yo estoy buscando por el fuente y no pueden encontrar, no sé dónde está. Mi amiga Meg, ella es muy alta y ella dice que está aquí. They don't know where it is. And then suddenly I stumble on it. It's like Meg said, there's a sense of discovery. It's a little pond with a little birch and a little bench. I'm exhausted. I've used up all of my reserves. I go to sleep. And when I wake up, I access something deep inside. It doesn't happen often. It's as if time collapsed. It's how I imagine eternity. All of us, all the dead people in this cemetery, all the people that I've lost and loved, and all of us here are connected. I don't know how I'm going to get through this, but I'm going to figure out a way. I don't know. The moment passes. This is really weird. I'm like in this cemetery with all these dead people. I mean, isn't that a little bit weird? But I've never felt so alone. Everybody, my husband Colin, my 3 kids, Lila, Corey, Zoe, they could go on without me. You know, with my patients who are depressed or anxious, they'll tell you that one of my favorite questions to ask them is, what's the worst thing that could happen to you? The biggest catastrophe. For me, it's not dying. It's sinking into a depression, inertia. I mean, what happens if I get depressed, irritable, push away the very people that I need to keep me strong? I think about my mother who died by suicide when I was 4 years old. And she must have been desperate to kill herself. I never want that to happen. I do all sorts of things to keep myself happy. I do meditation, cross-country skiing, yoga, good boundaries. I've had 700 years of therapy. But this is different. This is about being uncertain and not knowing what's coming next. I mean, I'll never understand why my mother killed herself, even though I've written a goddamn book about it. I know I'll never kill myself. I take enormous pride that I've been there for my kids. But what if I had to fight this illness and I lost the will and I wasn't motivated? For my patients who are depressed, it's an act of courage to wake up every morning. I look at the geese, and I look at the clouds. I'm in the storm right now. I'm in the storm right now. And it's going to pass. People say I look serene. How can that be? What is done with a severed breast? Wrapped in my prayer shawl, a dream in the making, I hate that which I love, disposed of now. I can only hope for hibiscus with tender flower, arugula with bitter taste. I purge to make room for the living. Old bottles of oil and vinegar, rotten fruit spilling from the bowl, burnt pots, broken dishes, I throw them away. Simplify without compromise. Prune the unnecessary. How simple can I make it? How complex must it be? What is gone cannot be replaced. Plastic is not like flesh. It doesn't feel like flesh. How hard is it for the dawn to rise? I'm going to the cemetery all the time. I'm learning a new language. Meg's teaching me. It's called cemetery language, like cenotaph. That's when a grave doesn't have a body, like if you've drowned or been in a fire. And poppies, that's when you have a flower that's on a tombstone. It means eternity. And I'm starting to be able to tell all of the different kinds of stones, like granite and marble and slate. And when the sunlight comes down at a certain angle and it hits the tombstone, you can read the words, and it's called raking light. I'm dying to tell Colin all about the cemetery. And Colin has headed up to here with death and dying. He tries to distract me, and he's like, "Come on, Nance, let's go for a bike ride. It's an awesome day outside." He's so excited that, I give in even though it's been 5 weeks since my mastectomy. And we're on this wooded path. It's like a wooded trail with roots and stones, and I'm holding on for dear life and can barely keep up. And finally, he turns around and he says, "How's the pace?" I go home and I am parading around the house naked. I had a mastectomy. I have a scar from here to here. I get it. Colin, he just wants things to go back to normal. The way that we have forged a bond over 31 years is hiking and bicycling and cross-country skiing, physically challenging ourselves. I feel damaged goods. Colin, he makes me pasta and grilled salad and arugula, and I ask him, do you want to hear what Emmy wanted her husband to put on her tombstone? My sweet Sumner, I'm sorry that I had to go. It was simply my time. You were always the stronger of us. I could have never held the tiller for you as you did for me in such dark and ravaging seas. In my days of passage, you were, and I knew you would be, perfect. I have left the stage, but I will never leave you. I'm in 1,000 places that will always be ours. Look for me in the sunsets, the ones that marry the light of a yawning day to the bright pink billowed clouds of a western sky. These are my sunsets, not yours. Live, my sweet Sumner. Live with every ounce of love that you still have to give. Do not question this hunger that still rides within your warm and pounding heart. If you get lonely, just look for me. I am there in the sunset. Listen closely, and I will whisper my blessing. Forever your Valentine, Emmy. Colin serves me more salmon and says, come on, honey, hurry up and eat your food before it gets cold while you're planning your funeral. It's hard. It's hard to bear the unbearable. A cockatoo escaped for 3 months, roaming the streets of Brookline, chewing holes in a retired judge's house with a beak that breaks walnuts or fingers. The cockatoo chooses seeds and nuts left by a Buddhist who removes bait from a trap to ensure the cockatoo's freedom. In a flock, a failing bird is shunned, learns to hide his illness. I hide nothing. And my flock surrounds me while I dance around my fear. I hide nothing. And my flock surrounds me as I dance around my fear. are heading to the beach, Cranes Beach. That's one of our favorite places to go. I mean, we come up over the dunes to this wide ocean. There are other people playing hooky. And there's even horses on the beach. And Penny, my dog, she's rolling around, and Colin, he takes off for a run. And I'm left wondering, how did I land on this Cancer planet with rules that I don't understand? I mean, I make up my own rules, like silly rules, like I steal stuff, like dried apricots from a fancy delicatessen near my house, or malted milk balls from a bulk bin, or lilacs from a neighbor's house. But that's like I deserve it, like it's rightfully mine. But this is different. I've been ripped off. I've lost a breast, and all I want is a run-of-the-mill day. I'm watching the waves crashing, and I'm trying to figure out a rhythm. And Penny's rolling in the sand doing her Penny thing, and all of a sudden, this ranger comes beeline for me. Right side of the beach, dog's on a leash. Left side of the beach, dog's not on a leash. Your dog is on the right side. Leash your dog. Okay, so I called Penny, put her back on the leash. Colin came back, and he wanted to cool off, and he took Penny off the leash, and he brought her down to the beach. I swear to God, that ranger was waiting behind the dunes. She comes barreling back with her ATV. I told you, put your dog on the leash. So I called Penny and put her back on the leash. Leave the beach. You only get one warning. She leaves. I am taking my sweet time. Who was she to tell me that I had to leave the beach? I want to kill her. She comes back a third time. I snapped. I turned around. I whipped up my shirt. I had a mastectomy. Do you need a handicapped transport? No, I do not need a handicapped transport. I am not handicapped. Surgery was successful. I don't have cancer anymore. But I still want my cemetery plot in Mount Auburn Cemetery. Colin opts out for this field trip, but he has his preferences. Southern exposure, not on the periphery, lots of sun. There are so many choices when you're looking for a plot. But I have myself a personal shopper. Jim Holman. Yeah, we can probably find you a nice place here. There's a lot of choices. You could be up high on the hill, near a dell, near the fountain, in a meadow, on the periphery, near a path, private, public, but we could figure it out together. And then look right here. That's an angel. It's the marble's kind of wasting away. It's the acid rain. Slate's a much better investment. Why, we have slate. You look at this one right here. You can see the detail on it. It's 150 years old, and you can still see the beaches and how the beach is coming down, the weeping beach. It's a beautiful specimen. Well, maybe you could go over here. That's a beautiful spot. It's over Alice's pond. Yeah, and you see that? That's a great sequoia. That's from California. 4,000 trees, and we don't have many from California. That's it. That's my aha moment. California. Colin's from California. It's southern exposure, sunny. And it's near Alice's pond. And the neighbors. You've got Edward Booth. Edward Booth, he was an incredible actor. He did Hamlet. He nailed Hamlet. Shakespearean actor, the best. And you might know him. He killed his brother killed President Lincoln. Oh, and Julia Ward Howe, she's right here. She's a pistol. She wrote the Battle Hymn of Republic. So if you like it, do you want to have a tombstone, a bathtub, a bench, a bridge? Maybe a bridge. That's okay, Jim. I'm good. I'm all set. But I will get back to you. I don't want to romanticize dying. I would be so pissed if I died right now. I'm healthy. People think that when you tell them you've had cancer, that it's a death sentence. I'm 100% recovered. And we're all terminal. I have more to become, more to be. For me, what's lost is lost. And yet, you mend me. And yet, I ache from the tenderness of your familiar touch.